Archie, do you want to turn on your mic?
Thank you.
Okay, meeting will come to order. Please join me in a moment of silent prayer or reflection. Terry, will you call roll, please?
Archana Aliar,
Here.
Nicole Cohen, John Maston, Kathy Cox,
Here.
Lisa Ramon,
Here. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Do I have a motion to review and accept the agenda for this session?
So moved.
Second.
Kathy Cox,
Yes.
Archana Aliar,
Yes.
Lisa Ramon,
Yes. Okay. Item 3.1 is the approval of emergency procurement of COVID acrylic safety barriers. And this is presented by Aggie Wolter and Mr. Murray.
Madam President, members of the board, it is recommended that the governing board approve the emergency procurement of acrylic safety barriers to support preventive measures to help mitigate COVID, not to exceed $190,000. During the COVID-19 emergency, LHUSD has taken actions to open all schools for on-site learning support in accordance to Executive Order 2020-51. All elementary schools are currently open for hybrid in-person learning and will be transitioning to full-time in-person learning after fall break. The district is requesting the purchase of safety barriers to help mitigate the spread of COVID and other respiratory germs for settings where social distancing may not be able to be maintained while continuing daily operations with all students returning to the classroom. This emergency procurement falls under the Governor's Executive Emergency Orders 2020-41 and the federal flexibility in funding for schools under the CARES Act in response to the COVID-19 emergency, which allows the waiver of the competitive bid process for purchases in excess of $100,000 for safety in response to the current health emergency. 3 quotes were obtained for the safety barriers. Due to the emergency and changing availability status of delivery, we are requesting to purchase the safety barriers through Schools In and/or CRISP Imaging. There were no approved vendors that were provided for safety barriers on the Arizona SAFE contract. Funds from the federal ESSER and ESG grants will be used to pay for the safety barriers as allowed under the federal grants. This action has been reviewed for purchasing.
Okay. Do I have a motion on item 3.1?
I move to approve 3.1 as presented.
Second.
Okay. Any discussion or questions?
What classrooms does this not go in?
Did you hear the question, Mrs.?
Yes, I did. The acrylic barriers will be used throughout our district in a variety of settings. We communicated with all the principals to go through their schools and look at areas and environments where they would need this enhanced support. At the high school, there are specific classrooms that it would be going into, the CTE classrooms, their credit recovery, their special education classrooms, their learning center, their science labs, the career center, and again, their computer labs throughout their campus. This isn't going into every single classroom on student desk. That's not what we're advocating for. We're looking at the common areas where multiple kids are needed to be in one setting, close, where we cannot maintain enhanced social distancing and still maintain the daily operations that we're required to do. At the Thunderbolt, we're looking at those computer labs, those resource settings, again, those intervention areas, again, those special education classrooms, those commonalities. At the elementary, again, the computer labs, their intervention rooms. In the classrooms where they're doing that small group instruction, where they need that enhanced separation, because most of those environments are being done either in a group table or if they're putting class desks together to be able to separate that so the kids who are not able to do that small group, in an enhanced setting once we return to full operation.
So I have seen these items in grocery stores, Safeway and Walmart. The people that are behind them do not observe them at all and will go around them, or the person who is doing the transaction at the store has to go outside of it to put a credit card in. What assurance do we have that these will actually be correctly used?
Well, it's a different environment where we're looking at them being the enhanced sneeze guard protection. As you well know, we do have at this time the order to have personal protective equipment, but there are individuals under the American Disabilities Act, Section 504, that may not be wearing masks due to their health needs. So there are situations where kids are going to sneeze, adults are going to sneeze. It helps to provide that extra barrier in those settings to help mitigate that spread. The way that they are operating and looking at that opportunity to use this is really that having their personal area where the kids are able to stay within that. It helps to keep some barriers for them. It is going to be a social environment in the classroom. People are going to be coming and going. We have been using these on a small scale since we opened up to on-site and started having to do evaluations this summer. With our therapists and our psychologists, so they've been in place and being used appropriately and under the small scale that we have been accessing and using them.
So those people that come in as a secondary person in the district, are they required to have protective devices on them?
Everyone at this time under the current executive order is to be wearing personal protective equipment in accordance to the order. But as you know, the order does allow for exceptions. We do have some staff and we do have some students that are in our buildings at this time that do have exceptions to it under the ADA. They do, with our policy and our working procedures, we do have a form for an exemption, and the staff have to provide that appropriate documentation if they're not to be in compliance. I mean, they're still in compliance, but they're not wearing it. On record, it's not just, I'm not going to, or my doctor says. We are requiring that medical documentation for our staff and for our students that don't already have that on file.
So what assurances do we have that this will actually work and will not be set aside by people within the system? Employees, assistant teachers, and teachers.
So the way these are set up, they're it's a little different from the grocery store. So we're talking about, like, in our computer labs, we have kids that would be facing each other this way. So it's actually just in between those computer labs or computers. So there's really no way to not use it because it's just already there. And then also there is some that comes out to give students a little bit of their own space if students are sitting next to them. And those are not, students couldn't remove them or take them down. They would be sitting there and used by them at all times. And it also comes down to, just like everything else with the mask or face covering, we'll be talking with our kids and reinforcing how to use it and why we use it. And our staff is pretty clear on the reasons, especially with these safety barriers. Our principals went through their buildings and talked with their staffs about where are places that we have groups together that we need to provide a little bit of extra protection, and they made those decisions with us. So I think that they will happily use them and keep them in place the way they're supposed to be.
Do we have any students who have not come into compliance with the COVID net regulations and actually need additional safety?
We have not had any requests for additional safety measures at this time.
Aggie, can you tell me what ESSER or ESG grants are? Sorry, I just don't remember.
No problem. And I apologize for that acronym.
That's okay.
Under the CARES Act, when they set aside funding for education, ESSERS is the Elementary Secondary School Emergency Response Act for funding specifically to address our K-12 or school systems throughout the nation. Under the governor's, I think it's called GEARS, governors, which is the funding that was under the CARES to give to each state governor. The GEARS also had funding set aside for education. And our governor has chosen to do what they call the enrollment stabilization grant, is how they're going to distribute that money under the GEARS that's dedicated or set aside for education. as we went through the opening of school under the alternate virtual reality, our state legislature had not come into being to be able to change the requirements of how they fund education, because it is under the legislation, but we do have our AOI funding, which is the alternative virtual. So the governor used that with the Department of Education to set up how they're going to fund education during this alternative enrollment. And so there is a change in enrollment funding, and that's why they're calling that the enrollment stabilization, knowing that to address loss of enrollment and also the change in how they are funding from a 95 to 100%.
And then, is this going to help us get our kids back at the high school level? Is this going to go a long way for that?
We're hopeful because, again, we're dealing with concerns emotionally that students and parents have for safety. We also are concerned about being able to maintain teachers in the classroom. So if we can keep our students healthy and keep our staff healthy, that we're not going to have a lot of people having to be out due to illness, whether it be COVID or the flu. We have a shortage right now with substitutes. And again, as parents and students feel safe, with the return, that will help with being able to move that along with the other data that we're watching. And as you know, those indicators are right now moving positively to returning to in-person learning.
So what are our additional costs to install the barriers?
Our staff, our custodial FSP staff will be able to put these together and be able to do that. So that will be done on each site. It will be obviously some time and effort that they'll have to dedicate to that, but it's not additional labor that we're going to have to
So
procure.
we're talking about, because of the amount of desks we're talking about months of rollout.
Not necessarily. We've been able to implement this relatively quickly. There's not a lot to the assembly. Obviously, some of the bigger computer labs are going to have to go in overnight and pull them apart, and they can get this done and in a very timely manner. It shouldn't take that long. The ones that are on the individual desk and computers, again, it really doesn't take that much time to assemble.
It's just like a 2 or a 5 screw attachment.
For the most part, obviously, some of these, based on the tables, like when you're getting into a quad, it's a little bit more pieces coming in, but most of them are literally 1 to 2 pieces, or they're like, said, 5 or 6 pieces where they're going into a slot and where you're putting them in, and then again, those that require additional screws to secure them.
If we had a teacher that required to have it installed for them to be at work, do we have a plan in place for that past our FSPs?
The site's administrators were working with it at this time. What has been requested is looking what's needed based on the program or the classroom needs. We haven't had a specific request that a teacher has to have this device from an ADA request. We would obviously prioritize based on needs, and that's exactly what we would be looking at.
Right, and any staff member can contact Ms. Vestadego in our personnel department. Sorry. And she's working with them on any needs they may have and really working through, okay, so if it is a concern that you need additional PPE or something else that we can provide in their space to allow them to come back to the classroom, we are doing that.
My concern is that we're equipped well enough with staff to actually put this quickly in place, because it's my thought process that COVID is going to go in the opposite direction, start moving down as we get a better and better handle on it as a city or as a county.
And I'm glad to hear that this isn't for every desk in every place in the entire district. So that wasn't clear when I read it. So I appreciate that information. That makes me change my mind.
Is the funding on this enough to actually roll the entire project out at everything that we have thought of?
As with any emergency, things come up as you get into working and things they haven't thought about. We have dedicated extra funds in this to not exceed, so to allow for some additional purchasing that may be needed in procuring that. It is our intent that the $190,000 will cover all our needs, and it does allow for the fact that there may have been a setting or input, and again, you have a teacher that comes in tomorrow and there may be those needs, so we do have that ability. We do have the funds in the ESSER grant that can allow for additional things if we needed to expand that as well. And we do have other items that are not obviously this large of a ticket item that we're procuring for our programs as well that are under, the minimal purchasing requirements like our band and choir to ensure that those things are being addressed.
Good deal.
If you get this purchase order out today, when do you expect the equipment to arrive? I'm sure it won't all arrive at one time.
No, some of these items are things they have in inventory, and so those will probably be turned around much more quickly. What we've been told is to anticipate 3 to 4 weeks before, because some of these items are what they consider customizable. They make them, but they're not things they keep in inventory, so they have to go in and cut and manufacture them. And the volume of what we're ordering may require additional materials to be procured to get this work order turned around.
Is any of this cut to fit?
Some of it is what they consider customizable, like I said, that it's based on what we're doing, but there are items that they have made before. Because again, when we look at a school settings, many of our tables and our settings are standardized. It's normal that these different ones, but we have different sizes. And then when we looked at our computer labs and looking at those pieces, some of those are larger piece items. So it's customizable in that it's not something they keep in inventory, but it's something they do manufacture.
Is this needed because we've had a diagnosis of a special needs kid with COVID-19?
No, we are advocating for this as we looked at steps with our reopening plan on suggestions on how to mitigate and trying to prevent. We don't want to have a open, close, open, close. We want to keep the environment as healthy as we can. We want to keep our students able to function as normal as they can. And so we're trying to look at the operations, getting back to some normalcy, but putting in some protective measures that can help to enhance the safety or to lessen the probability of a spread. And again, it's not in response to a specific student that's had an issue within our district. It's really about best practices. And again, we know this is uncharted territory, but looking at things that have been done, what has worked well. And again, here are some suggestions. These things we have, like I said, purchased on a smaller scale some of these this summer for the one-to-one, and with the opening, and it's worked. It has made our staff feel more comfortable, because you can't be 6 feet away, with much of what they have to do. And when they're testing or evaluating, it does require a little bit closer contact for students to see the materials and being able to do that safely. So it has created a safer work environment.
Do we have a testing basis on this in the actual rollout that it's going to do and how it's going to actually kill the transmission of disease?
No, that hasn't been tested. Sneeze bars, as far as the use of them, where when you start to look like with the CDA, the federal, and Food Drug Administration, the use of sneeze barriers is a common practice and has been in place. That's why you've seen that rolled out at a commercial level, knowing that we have history. These are things that we do know prevent the spread of transmission. So from that piece, there's evidence on the use of them, because historically we've been using them for a while in different environments. But in this particular situation under COVID, it's not something that's been completely researched, again, time-wise, evidence-based.
So I know that we all hope that the trend for the virus goes down. I just want to mention a couple of things. The report on September the 10th, there were 454 new cases. And remember, that's based on testing that was done 2 weeks prior to September the 10th. We've established that. And then on September the 18th, there were 2,000 new cases. That's just a few days ago. However, that's based on testing that was done 2 weeks prior to that. So right now, when we talked about going back to school or keeping kids out, whatever, I believe the county or the state said that a positivity rate less than 10% would be safe. We talked about, most of us did, we didn't come to consensus and we didn't put it in a motion, a positivity rate of 7%. Right now in the county, it's 8.2% positivity rate. So, I don't think we've had the fallout from Labor Day yet. I think will continue to happen for a while. So my question is, if we're going back to school on October the 12th, the preceding week is fall break, we're not going to have a chance to get together and look at and analyze things and think about things and whatever. So that's really out of our hands. So I know that Dr. Stone, I've talked to her before about the county and their part in all of this. Would the county warn us if the positivity rate is at 10, or we might have to have an emergency meeting or whatever? I don't know.
So the health department has been extremely responsive. We have cell phone numbers of folks at the health department, and they are working with us every day if we have questions, if we have concerns. At this point, actually, Lake Havasu City is a little better than the actual county. And what they've reported to us is very positive, and they don't have any concerns. Even as they look, it's hard because they report the information 2 weeks back, but they have more current information that they kind of look at and analyze and know kind of where we are. They do not have any concerns at this time of us continuing with our reopening plan as we have it.
So once school starts, you told me that the county really is the enforcement agency. It's really under their determination whether we close a school or whatever. Can you elaborate on that?
Sure. They don't decide. They would make a recommendation
Okay.
to you. And what they look at what they're really looking at is if you have multiple cases in one school, and then is that really growing exponentially? If it's not, and it's an isolated case or two, their intention is to leave us open.
And they, when there is a case, they come in and they do tracing, and they try to figure out who is exposed to that student or that teacher. Is that
They
correct?
actually work with our COVID point of contact in each school, and a survey is filled out to really determine who was exposed or who had longer exposure, so they need to quarantine right away, or who had some sort of contact and they just may need to be notified.
Okay.
I'd like to ask a question in regards to the opening. We never took a vote to close our schools as a board, so it seems to me that the board would then not have to vote to open our schools since we never voted to close them. So I feel confident as long as our superintendent is on top of everything that she can make those decisions, and I'd like to call for the question on this topic.
I'll agree to call the question unless, we haven't heard from Mrs. Aliar. I didn't know if she had any questions or discussion points.
I don't think we had an option to,
Put your microphone.
I don't think we had an option to close the school as such. It just, circumstances determined that. But now we have every day some new knowledge and some new guidance. So I don't see why we as a board should not take the responsibility.
And then for my part of this, what I would like to say, just in relation to the acrylic barriers, which is what we've come here to talk about today, that the funding for this does not come out of our existing budget. It is a special fund that has been set up to deal with these specific circumstances. And then the other thing that this helps us do is our board did unanimously approve a insurance policy. And part of the terms of that insurance policy is that we do what we can to keep our schools safe and mitigate the risk. And so this helps us be in compliance with that insurance policy. Okay, and then I will call for the question.
Nicole Cohen?
Yes.
John Maston?
Yes.
Kathy Cox?
Yes?
Archiana Aliar?
Yes.
Lisa Roman?
Yes. Were there any further announcements to make at this meeting? Okay, then I will entertain a motion to adjourn.
I move we adjourn.
Second.
Kathy Cox?
Yes.
John Maston?
Yes.
Nicole Cohen?
Yes.
Archiana Aliar?
Yes.
Lisa Roman?
Yes,
Thank you.
meeting is adjourned.